6 common myths about diabetes. The aim of diabetes management is to ensure a good quality of life and free our patients from diabetes complications. It is common for many patients to become distressed when they are told that they have diabetes. However, this is one disease that, if managed well, may not cause you any harm. As a diabetes patient, you may receive conflicting advice about what you should do and what you should not do. This might increase the risk of developing diabetes complications when you follow the wrong advice. Here are 6 common myths to help you separate fact from fiction. Myth number 1. Consumption of long-term diabetes medicine can cause kidney damage.
There are patients believe that if they take the medications for long term, it will harm their kidneys. However, this perception is not true. Taking diabetes medications does not harm the kidney, but high blood pressure, uncontrolled glucose, and smoking are the culprits for kidney damage. However, medicine needs to be given under supervision because our health condition changes from time to time. It is crucial to let the doctor prescribe medications that suits your health status. Early diagnosis as well as early management with medicine, diet and exercise provides the best outcome and best quality of life for patients.
Myth number 2. Medicine or diet alone is enough to control diabetes.
Some patients worry that their medication needs to be taken for the long term. Therefore, they delay getting medications for years. And by the time they start taking the medications, sometimes it's already too late and the harm has been done to their vessels. There are certain of our patients can control their diabetes by diet only, but majority of the patients need diet and medications to achieve optimal control and prevent complications.
Myth number 3. Good vision means patients with diabetes have healthy eyes.
Good vision doesn't mean patients with diabetes have healthy eyes. This may be a disaster waiting to happen. Significant and progressive retinal damage may be ongoing without any symptoms, and symptoms may appear in a very advanced stage. Hence, early detection and prompt treatment will result in better outcome. The picture on the right is the eye nerve of a healthy individual. The left eye is the eye nerve of a patient with diabetes. As you can observe, there is so much of changes already occurring while the patient is asymptomatic. Screening and monitoring based on the retinal status of an individual is very essential. Prevention is better than cure.
Myth number 4. My diabetes is well controlled, so I will not get diabetic retinopathy.
This is not true because most diabetics will eventually get diabetic retinopathy, and this can lead to blindness. Statistics show that 1 in 5 diabetics will eventually get diabetic retinopathy, and that this complication is very closely linked not only to the poor control of diabetes, but also to the length of time the patient has had diabetes. If the patient has got high blood pressure, the risk is even greater. Screening for diabetic retinopathy should therefore be done within 5 years of the onset of diabetes, and yearly examinations should be done thereafter.
Myth number 5. People with diabetes cannot eat rice.
Many people with diabetes will think that they cannot eat rice. Actually, this perception is wrong. Rice is one of the food sources for carbohydrates. Carbohydrate can raise the blood sugar levels in both diabetic and also healthy people. Eating the correct portion size of carbohydrates is rather important in controlling our blood sugar level.
Myth number 6. There is no cure for type 2 diabetes.
The disease is controllable with lifestyle changes, oral medicine, and insulin. In some cases, people have been able to return their blood glucose level to normal and stop their medicine. Doctors refer to this as remission instead of cure because the risk of relapse is very high. People have achieved remission through sustained weight loss, healthy eating, and making physical activity part of their daily routine.